Hi, my name is Michelle Freeman, and this talk will be about my proposal to create a biodegradable piezoelectric force sensor for intracranial pressure monitoring using methods such as electrospinning, thermal compression, and solvent casting. And the picture on this slide is of a biodegradable force sensor that served as an inspiration for a monitor specifically for intracranial pressure. I divided this talk into 3 parts, and these are the background on intracranial pressure monitoring and the scientific principles underlying my proposal, state-of-the-art devices, and my proposal specific aims. First, I will discuss the background information for this proposal. Traumatic brain injury is extremely prevalent in the United States. It's the leading cause of death for males under 35, and 2% of the population suffers from a traumatic brain injury. The picture on the right displays locations of different hernias when intracranial pressure is disrupted. So intracranial pressure, or ICP, increases due to brain injury, and it can be the first indicator of worsening outcomes in patients. So because of this, monitoring pressure is an important clinical tool that doctors can use to inform their treatment decisions. However, current devices, which I will discuss later in this presentation, have many complications associated with them. My proposal mainly uses the principles of biodegradation and piezoelectricity. And some important considerations for biodegradable devices are that the degradation time is controlled since the sensor needs to last for a certain amount of time, and that the performance remains consistent during its intended use of time, even if it starts to degrade during that time. And also it's important that no harmful substances are released into the body when a sensor degrades, and this is particularly important in electronic devices. And the picture on the left shows a biodegradable sensor as it degrades over a period of 30 hours. And the other principle that my proposal mainly uses is piezoelectricity, and this is when stress or vibrations cause a polymer or a material to line up properly, and then an induced dipole is created. And then this induced dipole can cause a voltage output that can be measured, and from this measurement, the initial pressure can be determined. And this picture shows poly-L-lactic acid, which is a polymer that I will be using in my proposal. And the carbon-oxygen double bonds that you see branching off the chains can provide an induced dipole when this polymer is properly arranged. Next, I will discuss the current state of the art for intracranial pressure monitors and the complications associated with these devices. There are both internal and external intracranial pressure monitoring devices, and these both have associated negatives. Internal devices provide the most accurate readings, but they require invasive surgery to insert and remove the devices, and this is particularly dangerous because intracranial pressure monitoring is often used for patients who have just suffered a traumatic brain injury, so they are more prone to further complications. And the most popular state-of-the-art device is an external ventricular drain, which is shown in the image to the right. And this device has many complications associated with it that I will discuss more on the next slide. So external devices can also be used to measure intracranial pressure, but they're not as accurate as internal devices and are thus not always appropriate for use. Some techniques include CT or MRI scans and also a transcranial Doppler, which is shown in the image to the right. But these devices are not as informative as invasive but continuous pressure monitoring devices. This slide lists some complications associated with internal intracranial pressure monitoring devices, particularly external ventricular drains, which are the state-of-the-art devices that I mentioned on the previous slide. So hemorrhages and accidental placement in brain tissue have been reported in 10 to 40% of cases, and meningitis and ventriculitis infections have been reported in 0 to 22% of cases. There are also complications associated with depressed skull fractures and second surgeries. And like I mentioned on the previous slide, this is particularly dangerous because the patient population who needs these types of monitors are often very vulnerable. The figure on the right displays large and small hemorrhages found after external ventricular drain removal in a study done on their safety. My proposal involves creating a biodegradable sensor that eliminates the need for removal surgery and thus would greatly reduce the instances of these complications. I will now discuss my proposal's specific aims. In my first aim, I will be creating 9 sensors and then determining their piezoelectric performance. And the material and synthesis methods that I chose were based on a literature review about piezoelectric biodegradable materials. So the first combination will be electrospun poly-L-lactic acid, and this is the polymer that I showed on a previous slide, and it will be electrospun at 3 different speeds to align the polymer. The next combination will be thermally compressed poly-L-lactic acid, which is the same polymer but a different synthesis method, and it will be compressed at 3 different temperatures. And then finally, I will have solvent cast beta-glycine chitosan, which will be created with 3 different ratios of the 2 materials. And once I've created all 9 sensors, I will use a mechanical testing machine and apply pressure to each of the sensors and record their piezoelectric output. And then finally, once testing is complete, I will select the 5 most piezoelectric sensors and use these sensors to continue my aims. Aim 2 will examine the piezoelectric performance of the sensors as they degrade in a simulated brain environment in vitro. And so I'll do this by taking the 5 most piezoelectric sensors from the previous aim, and I will place them in a phosphate buffered saline solution to simulate the brain environment, and then I will create a pressure changing device similar to what a previous paper has used for their intracranial pressure research, and this device will allow me to manually change the pressure of the fluid and monitor the sensor's piezoelectric outputs over time. And I will repeat this process over 14 days as the sensors degrade, and that time is based on a study examining the length of time that external ventricular drains are used for in the hospital. And then once this is complete, I will select the 3 most accurate and best performing sensors for use in my next aim. For my final aim, I will select the 3 best performing sensors from the previous aim and implant them into the intracranial part of the brains of several different mice, and I will implant an external ventricular drain simultaneously in each of the mice to compare the outputs of the pressure readings. And there will be a control group with baseline intracranial pressure and a treatment group whose circle of Willis, which are the arteries at the bottom of the skull, I will perforate to induce intracranial pressure changes. I will monitor the intracranial pressure of the mice for 14 days and record the degradation rate of the sensors, and after this, I will continue to monitor the devices until they have fully degraded to ensure that they are degraded safely in the body. Intracranial pressure monitoring is an important clinical tool that can help doctors make informed decisions about patient care for those with traumatic brain injuries. My proposal uses the principles of piezoelectricity and biodegradation to create an intracranial pressure monitoring device such as the one seen on the right. Current monitors have the potential to be improved since internal devices have many associated complications such as hemorrhages and infections, and a hemorrhage can be seen in the picture to the right from an external ventricular drain, and external devices are not accurate enough for most uses. In my proposal, I will create 9 sensors with various material and synthesis method combinations and determine the safest and most accurate sensor after performing in vitro and in vivo experiments. Thank you for listening to my presentation, and now I'm happy to answer any of your questions on the Canvas discussion thread.